Welcome back, everyone. I'm joined now by Dr. Joan Pellegrini, a surgeon with St. Joseph Healthcare. Thank you for taking time out of your busy schedule to join us today.
Oh, thank you very much, Peter.
And I understand that the type of surgery that you specialize in is a bit unique. You're called in often to emergency situations. So tell us a little bit about your background and the work that you do.
So my whole career, I've been a trauma acute care surgeon. I don't do much trauma now. I do acute care, which is emergency surgery. So I do some elective, but my real focus is acute care surgery, emergency surgery through the emergency room, unplanned for me and for the, well, for me, I know I'm going to have something, but for the patient, and I've pretty much done that my whole career.
And what's that experience been like for you, and how have you kind of adapted to that over the course of your career?
So I didn't really have to adapt. I came up to Maine, and that's what I came up for, was to do that. And 25 years ago, we didn't have a term acute care surgeon, so I kind of helped develop that in this area. And it's a different personality for the surgeon that sees a patient and hasn't had time to really work things up. The patient hasn't had time maybe to plan for surgery. And so it takes a different personality, someone that can deal with a changing situation very quickly.
Is it fair to say that surgery is a fairly male-dominated field?
It is, but fortunately it's getting less and less fair to say that. Women are becoming much more common to see. When I started, I was one of only a few surgeons in my program. And you know, the country, people are starting to realize that diversity is a good thing, because let's face it, men and women have different ways of thinking about a problem. And so if you can have those different ways of looking at a problem, different ways of addressing a problem, it really helps. And then you also have patients. I have a lot of patients that feel more comfortable with a woman.
Sure.
Obviously, some patients feel more comfortable with a man. So you've allowed your patients in this area to have a more diverse option when you have men and women in surgery.
Absolutely. And talk about your community impact as a surgeon and also working with St. Joe's Healthcare.
Well, I've allowed the community to have a robust surgical response. So people now know they can go to either ER, they're going to be well cared for. Both hospitals have acute care surgery. St. Joe's really now, I think with what we've been building, has a very nice, robust response of being able to take care of a lot of problems. We can't do everything, but we can do almost everything, you know, general surgery, when people need it. And that's been a very nice thing to have.
So as a woman in the field, what's your advice for maybe young women thinking about their careers and maybe thinking about getting into the medical field in general?
So what I tell women is don't listen to people that say you can't do it. You know, if you have something that you're interested in, and this isn't just surgery, this is anything, explore it. See if you have the right personality, do you have the right skills, and look at it, because you won't know if something is right or wrong for you till you actually look at it. And I tell a lot of, when I have college students and they say, well, it's so hard, you know, I'm never going to be home, how am I going to have a real life? And I tell them about my life. And it's just a normal, real life, and the life of other female surgeons. I mean, it's a hard life, but it's no harder than really anyone else's in some aspects. And it can be a very normal life.
And very fulfilling, I'm sure, too.
Yes, very.
All right, well, Dr. Joan Pellegrini, thank you so much for taking the
You're
time
welcome.
today. All right, and stay with us. Your full extended forecast is coming up.